Governor Abbott, thank you so much for joining us. What do you say to Democrats who say you're reopening the economy too soon, and to conservatives who say you're not reopening the economy fast enough?
So it's so incredibly important to everyone in your audience to know that decisions to open up are based upon two key factors, and that is all the data that we look at every single day, as well as input and advice from some of the very best doctors in the United States. We have a doctor who was the head of the FDA and the head of Medicaid and Medicare for the United States. We have a doctor who's a leading infectious disease control specialist, including a doctor who's in charge of tracking and tracing COVID-19. And so we know for a fact that the strategies that we are using to open up the state of Texas in the way that we are meets doctor approval. But it makes common sense also when you think about the types of businesses that have been open for the past month. Grocery stores have been open, hardware stores have been open, but in a limited capacity way. And so we are just replicating the standards that have been used effectively over the past month, while also reducing the spread of the coronavirus.
This week, your office reached out to a Dallas salon owner who has defied the order and has reopened her business. She faces the possibility of being arrested. What is your message to her, and what progress, if any, has been made on deciding whether and when salons, barbershops, gyms, and bars can reopen?
First, we want hair salons, nail salons, barbershops to be open as quickly as possible, and we're working on that on a daily basis. And so, as part of that process, we wanted to reach out to her, as well as other salons across the state of Texas, and get their best ideas, their best strategies, understanding this fact, Jack, and that is that when you're in a hair salon, you're having people very close together. Who hopefully are wearing face masks, but because of the closeness, it can increase the possibility of the transmission of things like COVID-19. So we're working on identifying the best strategies that can be used in hair salons, et cetera, but also strategies that the doctors feel comfortable with will reduce the spread. So we know there's a need for these salons to be able to open up. We know their businesses, they need to start generating income and revenue again. And so we are working on this swiftly and hoping for an announcement sometime soon.
What is your message to her, though? Should she be open?
Well, obviously, she needs to follow the law and make sure that she abides by the appropriate standards. But also, equally importantly, as she knows, we are working with her on what we think collectively would be the best strategies going forward.
As you know, experts say this state needs more testing. Are you satisfied with the level right now, which is about a little over 1% statewide? And what are you doing to get more tests here?
Listen, there are stories today about even more tests coming from Abbott Labs. Understand this, and that is the primary source of new testing is coming from the private sector. And it is ramping up very rapidly. And so the amount of testing will continue to increase. But understand this on the percentage basis, and that is on a percentage basis. Texas is pretty much in line with where we are on a percentage basis in the percentage of deaths. So Texas has one of the lowest death rates in the United States if you do it on a per capita basis. On a raw number basis, Texas ranks fourth in the United States on the number of tests. But Jack, all of that is to a point to the aside, because know these numbers going forward. The most important numbers going forward is that we will see a dramatic increase both in the number of tests as well as the number of people who test positive. Those are not the important numbers. The important numbers are these two things. One is of the people tested, what is the percentage that test positive? Earlier this month, those who were testing positive were testing at about a 10% rate. Now, after today's results, it's at about a 6% rate. The other important number is, what are the hospitalizations? The number of people hospitalized today is fewer than hospitalized yesterday. Those are the two key metrics we will continue to watch for to find out whether or not we do or do not have a serious COVID-19 challenge in Texas.
And so you're saying as long as the hospitals are not overrun, any increases can be accommodated?
Right, and so this was the issue that the United States wanted to grapple with as a country early on, to make sure that the United States did not face an issue like what we saw in Italy or some other places. We did see that in places like the New York, New Jersey area. We saw it in New Orleans. We've seen it in some other locations, but we haven't even come close to having that type of challenge in Texas. We've always had plenty of hospital beds and ventilators and ICU units in our, we never have had a compromised capacity at our hospital facilities. Our goal is to make sure we maintain that capacity so that if anyone does fall ill because of this, that there will be medical care available for them.
As you know, in North Texas and statewide, there are a lot of large offices. When do you expect on making an announcement when people can get back to work?
Sometime soon on that. So we continue to work on a daily basis, funneling ideas to our medical team for their evaluation. And that's one that we are talking to them about as we speak, and that is the ability for these large offices to open up. Understand this, and that is, if you would, in some of those large office towers, they have solo practitioners in some of those large office towers. They are already authorized to return to work at this time.
And as far as childcare, I know kids whose parents are essential workers are provided childcare, but those workers who are going to have to return to work tomorrow if their employers open up who are non-essential, what are they going to be able to do? Will childcare be made available for them and their children?
Sure, we know this is a very important issue for all of these workers, all of these families, because so many workers who have families have kids, and they need to be able to balance that in their ability to go back to work. And so we are also working with our doctors today on solutions to expand childcare. As you pointed out, we do have childcare available for people who are categorized as essential workers. Our goal is to be able to expand that to non-essential workers, but most importantly, like we do everything, we want to do so in a safe way so that we will have children who are being brought in from different families who may or may not have exposure to COVID-19. We need to make sure that to the extent we open up childcare, we're not going to be expanding COVID-19 in Texas.
And any indication of how soon you may be able to make an announcement about that?
Again, it'll be as soon as possible. It works this way. The announcement will be made as soon as the doctors are able to come up with a system where child care, where children are coming in from different families across the state of Texas, where that can be opened up in a way that does not promote the spread of COVID-19. And that's a medical decision that I don't have the ability to give you a timeline estimation on.
Regarding social distancing and social gatherings, how long do you anticipate social distancing being required here in Texas? And then also, as far as the social gatherings, are they still limited to 10 for people, aside from, you know, when they go out to retail, et cetera?
Sure. So know this, and that is the coronavirus still exists. It has not gone away, either in Texas or the U.S. or worldwide. And the transmission rate is still as high today as it was before. The only thing that we did in the state of Texas and elsewhere is slow the growth of the spread of the coronavirus by these distancing practices. As a result, until we have these therapeutic drugs or an immunization for it, these social distancing practices must be maintained. And that would be things such as trying to remain 6 feet away from people who are not in the same household. It will mean things like wearing masks wherever possible, and things like that to make sure that we do all we can to continue to prevent the spread of COVID-19.
And then as far as the social gatherings, Governor, do you still want them limited to 10 wherever possible?
Yeah, we want social gatherings to be limited primarily to people of the same household, people who are traveling together, like they're allowed to travel, let's say, to a movie theater together or to the mall together. But we are still urging that those social gatherings be minimized in number as much as possible.
And then one quick question about contact tracing. I know the state is going to beef up to about 4,000. How important is that, especially if testing doesn't ramp up as much as the state wants? How important is that in trying to minimize the spread of the virus?
Well, it's a proven strategy that goes back to the days of tuberculosis and has been used for decades. And we have an effective team in place already and a sufficient number of tracers to make sure that we will be able to have the structure in place where if a person tests positive for COVID-19, we can be in contact with everybody that person may have been exposed to help make sure that they have the care they need and they are not exposing themselves to others. And that is the strategy that is best qualified to make sure that we can contain the spread of COVID-19.
Governor Abbott, thank you so much for your time today.
Thank you.